Hello, this is Christopher Mitchell, and today I have a model that I made out of that represent the lungs, the green balloons, the diaphragm with the pink, and the bronchi with the two straws here. I'm going to be explaining the process of inhaling. As you can see, I'm going to demonstrate. The diaphragm expands, the lungs expand, and this is a active process causing inflation that allows the diaphragm to expand. This process is stimulated by chemical receptors in the aorta, and accessory muscles are used in the ability for the lung to increase volume during inhalation. The process of exhaling, as you can see, I'll demonstrate. When the lungs are expanded, they will exhale. So the process of exhaling, as I just demonstrated, is a passive process powered by the elastic recoil lung properties. Surfactant is a chemical produced by the lungs that prevents the lung from collapsing, as well as maintaining the surface area of the alveoli. The processes of inhalation and exhalation can be affected by depth and rate of breathing, resistance of the airway, and compliance of lung expansion. So you can see this is my lung model, the lungs, the bronchi, and the diaphragm. Lung capacity or lung volume is affected by age, can be affected by height and gender, as well as underlying conditions of the respiratory system. And really, the lung capacity can be affected by things like obesity, lung conditions, exercise, and even pregnancy. These reasons are why some people may have larger or smaller lung volumes. Asthma is a condition that affects the lungs by a combination of clinical manifestations in the respiratory system, as well as bronchial hyperresponsiveness limitations on respiratory airflow. It is classified by persistent inflammation of the airways, resulting in bronchoconstriction or edema of the airway, which can affect breathing, make it difficult. The airway can be squeezed by the surrounding muscles that are enlarged, and increased secretion of mucus is also very common with asthma and how it affects the lungs. The priority care for a patient with asthma is to ensure adequate oxygenation and clearance of the airway. And professional care focuses on assessing the severity of the asthma, implementing initial treatments, and regularly monitoring the client that has asthma or had an asthma attack. Medications that may be given for initial treatment or long-term management include long and short-acting bronchodilators, as well as anti-inflammatory drugs such as corticosteroids. During an asthma exacerbation, the nurse should have the patient sit forward, maximizing diaphragmatic movement, oscillation of the lungs upon assessment, providing medications through inhaled SABA or albuterol and corticosteroids. And if it's severe asthma exacerbation, the nurse would administer IV magnesium, as well as ipratropium. Education for the patient with asthma would include how to safely use their inhaler or the nebulizer, educating on the purpose of pathophysiology of the drug that they're using and what asthma is so that they understand their condition. It would be important to educate on the importance of compliance with medications, how to properly clean and use all equipment that they are given, and also educating on the side effects of medications, as well as effects that can occur if medications are not taken regularly and according to the administration schedule. The nurse should also educate on different exercises for breathing, as well as methods that the patient can use to promote comfort, which would all be very important teachings for the patient with asthma. There are several community resources in Arizona for people with asthma, which include the Arizona Asthma Coalition, the Asthma Athletics, Banner Children's Asthma Support Groups, Breath Mobile, the the American Lung Association of Arizona, as well as many more that are available throughout the state of Arizona, providing support and resources for adults and children living with various types of asthma that are affecting them in various different ways. Thank you very much.